Hey everyone, and welcome to The Explainer. Today, we're diving into stuff that honestly sounds like it was ripped straight out of a sci-fi movie, but it's not. It is happening right now in clinics and labs all over the globe. We are literally witnessing a monumental, revolutionary shift in modern oncology. We're stepping into the era of a totally new cancer arsenal, and the breakthroughs we're seeing in 2025, they're fundamentally rewriting what a cancer diagnosis actually means.
So let's kick things off with a pretty massive question. What if literally everything we thought we knew about treating cancer was wrong? For decades, we've basically just accepted a standard of care that is frankly brutal. We've just accepted that curing the disease means you kind of have to destroy the body in the process. But the incredible research we are unpacking today proves that this doesn't have to be the case anymore.
Here's our roadmap for today's explainer. First, beyond slash and burn. Second, unleashing the immune system. Third, precision weapons in microtech. Fourth, treating the whole patient. And finally, access, hurdles, and hope.
All right, Section 1, Beyond Slash and Burn, a new paradigm.
Traditionally, chemotherapy and radiation have basically been blunt instruments. They're totally indiscriminate. They attack all rapidly dividing cells, which, sure, kills the cancer, but it also causes devastating collateral damage to healthy tissue. But today, the new way relies on targeted therapies, like antibody-drug conjugates. Think of these as guided missiles. They combine the tracking ability of an antibody to find the exact cancer cell, and then, bam, they deliver a payload of chemotherapy directly inside it, completely preserving the rest of the body.
Moving right along to Section 2, Unleashing the Immune System. Biological warfare.
To really grasp how life-changing this shift is, you've got to hear Maureen's story. Maureen was diagnosed with gastroesophageal cancer. Her doctors initially gave her the standard playbook: chemo, radiation, and a brutal surgery to remove part of her esophagus and stomach. As Maureen put it, "I wouldn't be able to eat or talk, my two favorite things in life." The traditional cure was threatening to take away her entire quality of life.
But Maureen ended up enrolling in a clinical trial at Memorial Sloan Kettering. This was specifically for patients whose tumors had a genetic mutation called mismatch repair deficiency. And the results? Absolutely staggering. 80% of the folks in her trial dodged surgery entirely, skipping the old methods and exclusively using a specific immunotherapy drug.
For Maureen, the outcome was basically a miracle. After just 6 months of this immunotherapy, her tumor completely vanished. No surgery, no losing her stomach, no losing her esophagus. She was left healthy, cancer-free, and most importantly, she kept her full quality of life. The immunotherapy basically just took the brakes off her own immune system, letting her body wipe out the tumor all by itself.
Let's look at another wild tool in this biological warfare: CAR T-cell therapy. First, doctors actually pull out the patient's own white blood T cells. Second, they take them to a lab and genetically modify them to recognize the cancer. And third, they infuse these brand new supercells right back into the patient to seek and destroy tumors. This sci-fi reality actually saved a 3-year-old boy in Germany named Yappa. He had a highly aggressive leukemia that just wouldn't respond to standard chemo. His doctors were totally baffled. But after getting CAR T-cell therapy, his newly reprogrammed immune system hunted down the cancer, leaving his blood completely cancer-free.
So the takeaway here is that our own immune system is our best weapon, right? Which brings us to a slightly bizarre, maybe even funny question. How on earth does your gut microbiome, yes, the bacteria in your stomach, fight one of the deadliest cancers on the planet? Pancreatic cancer.
Well, as the sources reveal, pancreatic cancer is notoriously tough to beat because it builds this incredibly hard, fibrous shell around itself. It literally blocks medicines and hides from the immune system. But researchers figured out that transferring healthy bacteria from a normal human stool into a cancer patient's gut via what is colloquially known as a poop pill can actually alter the patient's gut microbiome. This really specific shift in bacteria makes the immune system hyperactive, allowing it to finally bust through that hard shell and attack the tumor. I mean, what an unbelievable intersection of biology.
Which brings us to Section 3, Precision Weapons and Microtech, Physical Disruptions.
Okay, get ready for Histotripsy. This is a totally non-invasive technology. It uses focused ultrasound waves to create tiny oscillating microbubbles right inside a tumor. These bubbles vibrate so intensely that they mechanically tear the tumor tissue apart. No heat, no radiation. In clinical trials for liver tumors, this procedure has an unbelievable 95% success rate, and the whole thing takes less than an hour.
Let's map out how this fits into the wider arsenal of microtech. We just talked about Histotripsy for liver cancer, but there's also the pretzel device for bladder cancer. Instead of removing the entire bladder, doctors insert this tiny pretzel-shaped silicone device that slowly releases localized chemo over several weeks. And then, there's probably the most mind-blowing innovation of them all: molecular jackhammers for melanoma. Researchers have literally created dye molecules that latch exclusively onto melanoma cells. When you hit them with near-infrared light, these molecules start vibrating in unison. It's exactly like an opera singer hitting that perfect pitch to shatter a glass. They vibrate so hard they act as nanoscale jackhammers, physically rupturing the cancer cells. In lab tests, this destroyed up to 99% of human melanoma cells while leaving all the healthy cells totally intact. Just incredible.
All right, stepping back from the microscopes, let's hit Section 4, treating the whole patient. Psycho-oncology.
This shift is beautifully captured by Susanna, a mom who was actually playing with her kids on the swings when she got her diagnosis. She said, "For me, the diagnosis is not a stroke of destiny, but a wake-up call." That perspective completely shifts the narrative away from victimhood to active living. And to support that, we're seeing amazing volunteer efforts, like this adult education center in Germany that puts together royal photo shoots for women going through chemo. Patients like Vanessa and Susanna are given gorgeous gowns and professional styling to reclaim their confidence. It creates these beautiful memories and really lifts their spirits during the darkest days.
This whole approach is formally known as psycho-oncology. It's the integration of psychosocial support, things like talk therapy, art therapy, mindfulness, working hand in hand with conventional medicine. Doctors are widely recognizing now that just fixing the physical body, it's not enough anymore. If 60% of patients suffer from severe anxiety or depression right after a diagnosis, we absolutely must heal the mind and spirit so they actually have the resilience to fight.
Finally, let's get grounded in Section 5. Access, hurdles, and hope. The systemic reality.
Because the stark reality, all this incredible science doesn't mean a thing if people can't actually access it. Cutting-edge treatments like the CAR T-cell therapy that saved little Yepa can cost up to 300,000 euros. That is a massive financial wall. So many of these miracle treatments completely depend on whether public health insurance or private providers decide on a case-by-case basis to cover those exorbitant costs.
And beyond the money, there's a huge regulatory tug-of-war happening. On one side, you have the FDA, which requires extensive, multi-year clinical testing to absolutely guarantee that any new drug is safe and effective. But on the other side, you have the right-to-try movement. For instance, Dr. Patrick Soon-Shiang developed a therapy that boosts natural killer cells without needing chemo or radiation. But right now, the FDA restricts its broad use. Terminal patients argue that if they are totally out of options, they should have immediate access to unapproved, potentially life-saving treatments now, instead of waiting years for trials to wrap up. It's an incredibly complex balance between protecting public safety and offering immediate hope.
So, pulling all of this together, what's the playbook for the next decade of oncology? Well, we are rapidly moving toward much shorter, highly targeted treatment sessions. We're seeing a massive shift toward convenient, at-home oral therapies. AI is driving advanced biomarker screening, catching things way earlier than we ever could before. And above all, the main goal isn't just surviving anymore. It's preserving organs and maintaining a significantly higher quality of life.
Which leaves us with one incredibly profound thought to wrap up today's explainer. With all these biological, physical, and holistic advancements, are we finally building a future where cancer is no longer this insurmountable, deadly opponent, but instead just a manageable chronic condition? Well, the science says yes. We're getting closer every single day. Thank you so much for hanging out with me to explore this amazing material. Keep learning, keep asking questions, and I'll catch you in the next explainer.